If you've been suffering from ongoing shoulder pain or neck tension and it's keeping you out of the gym, you've probably not been incorporating well this one exercise. When we think about our shoulder, a lot of people tend to think about the joint itself, but what we need to remember are all the muscles that come up from our back and insert onto that shoulder girdle, as well as the muscles that come down from the neck and insert onto our shoulder blade. Our thoracolumbar fascia, which is this part of our back right here, it connects from the thoracic spine down to the base of the lumbar spine, has many insertions, predominantly your latissimus dorsi as well as your glute max. Those are the two largest muscles on the body. The thoracolumbar fascia, or the TLF, is responsible for things like load transfer, organization of movement, respiration, and helps to give us support in our posture and in our torso. So when we think about shoulder range of motion, when we get reduced range of motion, that can be a dysfunction of the muscles passing through the thoracolumbar fascia and this transmission of force. Now, muscles and fascia should be sliding and gliding well. For many reasons, they don't. For example, inflammation. Inflammation can be a result of heavy exercise training, stress, lifestyle choices, poor sleep, food intake, alcohol. All of these different factors can influence how you feel in your body. I use the lat pull-up to help restore normal body mechanics, decrease pain and tension, restore good shoulder stability to the shoulder blade, decreasing the tension from the neck muscles, from stabilizing for the lat. This increases your range of motion, your functional movement patterns, and has a significant impact on so many other movements in life. There are 4 key things we want to think about when doing the lat pull-up. First, we want to make sure that we have good shoulder range of motion. Generally, if someone can't raise their arm beside their ear, we can do a regressive form, meaning we use a band or an assisted pull-up, which are equally just as beneficial. Second, you want to start the movement with your elbows straight. If we start holding and we have a bent arm position, we take the force into our biceps, which reduces the amount of tension and force going through our lats. Third, get a nice tight grip of that pinky around the bar. That grip strength is so important to activate the entire myofascial chain. That's all the muscles going all the way from the hands down into your back, and will help activate all of the core musculature as well. Final point is timing. Making sure that the first movement you do is a depression of the scapula. That means pulling the shoulder blades down away from the ears, engaging those lat muscles, holding on tight. Now, when you perform this movement, you're going to have your elbows pulling down in front, and your body might end up on a little bit of an angle. That is completely normal, and we want that to happen to ensure good lat activation. Practice this exercise either at the gym or get in touch with a professional who can look at your technique. And I have so many clients who have benefited from this. Their shoulder pain goes away in days, giving them back the ability to do the things that they love.